Hi, I'm Dr. Shruti Tannan. I'm a board-certified plastic surgeon, and I want to tell you what exercises to not do, what exercises to avoid if you have implants underneath the muscle. This is important so you can have the best long-term result for your breast augmentation or your breast implant surgery. So first, let me explain where the implant is sitting, and that'll help you understand why you should avoid certain specific exercises, and I'm going to demonstrate them too. So your pec major muscle, which is the muscle that we put your implant underneath if you have submuscular breast implants, its job, it will push against your chest. So your muscle's designed to push against your rib cage every time you contract it. So every time you contract your pec major muscle, your implant's getting pushed off to the side. That's not going to lead to a beautiful long-term result. So my recommendation for you, I have a few things. I'm going to explain them in words, and then I'm going to show you some demonstrations. So when it comes to strengthening exercises, I recommend you completely avoid doing isolated pectoralis strengthening exercises. Specifically, I would no longer include chest press, and that means like military press, upright, whatever, however you do your chest press, however you're doing your isolated strengthening of your pec major muscle, stop it. And that's because, again, every time you're contracting your pec, yes, you're strengthening it, and you're also strengthening the force of that contraction, pushing that implant off to the side. That also goes for fly. I would stop doing fly. Anything that's exercising your pec major and solely working on strengthening that, stop doing it. So a modification that you can do to some of your full body exercises, like burpees or push-ups, are instead of having a wide stance for your arms, bring them in closer, hug them into your body closer so that you're 90 and 90 degrees at your shoulder elbow. And the reason for that is we want to avoid using your pec major, and instead we're going to rely on your triceps to help support your upper body. Of course, you're utilizing your core. This is a full body exercise when done properly. Obviously, I'm a plastic surgeon. I am not a personal trainer. I'm giving you my recommendation for how to maximize your results. So let me show you a quick demo. So what I don't want you to do is any chest press. So anything that's involving your muscles like this, you don't want to do fly, you don't want to do bench press, all of those are no-goes if you have implants under your muscle. People have asked me, is this just temporarily for like that first month, or is it forever? I'm telling you, my recommendation is to not do this ever again. So when you're doing push-ups, it's really important. I know that traditionally people will have their arms out to their sides like this, and this really utilizes your pec. My recommendation is that you change your stance and really focus on using your triceps. Bring your arms together. Bring them in closer underneath your shoulders and really use your triceps rather than having that wide stance where your arms are out wide and you're really using your pecs. The reason is we're trying to minimize pec muscle contraction, isolated pec muscle contraction. So any kind of modification you can do for your planks, your burpees, your push-ups will help you have the most beautiful long-term result for your implants under your muscle. Follow us for more tips.